I'd just like to inform the listeners of exactly what it is that the Collaborative Care Collective Association is and what are we doing. And so I guess we'll start with that.
C3, or the Collaborative Care Collective, is really, it was, I would say, a calling for me. And I know that sounds maybe heavier than it needs to, but it's the truth. And what I mean by that is that there was one patient in particular that motivated me to learn a lot more about the case of sacroiliac instability. And I learned how to diagnose that from a physical therapist colleague of mine here in town named Don Sandalchidi, who you know, Chris. And this client happened to be another physical therapist in town, and her story was a sad one, and had been out of work for like 6 years. And so the recognition that an excellent physical therapist working in my town could be out of work for 6 years because of a rather simple case, in my opinion, of sacroiliac ligamentous laxity from birth and some hypermobility was enough to put her out of work for 6 years. And she had sought excellent healthcare providers from the traditional healthcare systems. To me, it was a shocker. It was saddening, and it left me with a longing for our healthcare system to be better at handling those kinds of patients. So that's really where it all started, Chris, was with a patient that was really a sad story, frustrating, and one of our own, a PT, which is your profession as well. And me being a physician, trying to manage her care, she was sent to me by another physical therapist. And I recognized that we needed to get this out there. I needed to find a platform by which to better educate other providers in the physical medicine space about how to work with more complex patients and work in collaboration with others to affect the best possible outcomes.